to this very simple, fruitful, significant engagement this afternoon. I'm sure it has become the most topical issue in the country. And it's prudent and expedient that as we have met this particular afternoon, we have this engagement to set the record straight.
Good afternoon. I want to welcome you all to this press briefing at the National Health Insurance Authority's headquarters. Let me say that this is a joint one for all the heads of facilities that we've selected to be part of this dialysis program and the renal units. We also have some celebrities here who are actually supporting this program in such a way that Ghanaians will understand exactly what the NHI and government perhaps is doing. So I'll start. I think the purpose of this meeting is to just give you details of what's going to happen on the 1st of December and the fact that we are united to bring comfort to our patients and the fact that we have thought through this carefully and the fact that we have worked out the numbers and we believe that the NHI can take on this dialysis without any problem, without the scheme being in any, the scheme having any problems. We've projected this into the future and we know the numbers. So I'll start. In the last 6 months, we've been doing a pilot of the dialysis program of the NHI. We started in June when children below the ages of 18 and adults above the ages of 60 were given 8 sections of dialysis for free. In between 19 to 59 were given 2 sessions for free. We had an allocation from Parliament, which was 2 million Ghana cedis. We looked at our corporate social responsibility budget and we added another 2.2 million. So the total amount that we used for the pilot was 4.2 million. And let me say that the initial submission, the initial list submitted by the Dialysis Association to us were around 700. But the numbers, the actual numbers when we did the pilot came to about 400. So what this means is that we use the 700 in our projection, but the 400 is what is the actual. So what this means that we still have some monies left. Now, what did we do? Why do we know that the NHIS is able to take on this dialysis program from 1st of December? So we use the prevalence rates of patients suffering with dialysis in the country. We got 2 research papers. One put it at 24 patients per million population. The other put it at 38.8, which is 39 per million population. So it's a simple calculation. So if 33.3, if 24 patients is to a million population, then what is 33 million population? So it's just multiplication, and you will get about 804. So it's 33.5 by the 24 patients. So that's the minimum. Then we look at the maximum. The maximum was 39. So it's the 39 times the 33.5 million population. And you get about 1,299. So they're within the range of 1,200. So we now looked at our actual as in the 400. So the 400, Parliament has also approved 491 for the dialysis sessions as per session. So what we did was we took the 400 as in the 400 as our actual. We just multiplied that by the 491 and we multiplied it by the 8 sessions, which is 2 sessions per week. So per month you will get 8. So when you do the mathematics, you will get 1.5 million per month. Then we multiply that by 12, you will get about 18 million. We rounded that up to about 20 million. So what this means is that the minimum amount of money that we need to kickstart this dialysis program is 20 million. Then we looked at what about if we open it up and the number doubles. So we looked at 800. We doubled the number. So 800. We only multiplied it by the fee that has been approved, which is the 491 by the 8 sections. You get about 3.2 million. Then you multiply the 3.2 million by 12. You get about 39.6, which is rounded up to about 40 million. So that's the second scenario. Then we looked at the third scenario, which is, what about if you open it up and 3 times the number obviously visit facilities? So 1,200 by the 491 by the 8 gives you about 4.7 million per month. If you multiply that by 12, you get about 56.4 million. So what this means is that we rounded that up to about 57 million. So annually, the NHI will spend between 20 to 57 million to cover the 1,002 patients based on the prevalence who are on dialysis. So, as I've given you, obviously, the mathematics of it, you know, the 800 actually corresponds with, the 800 prevalence corresponds with our second modeling. And the 1,002 also corresponds with our end stage modeling, which is the final modeling. So the number of patients by our modeling on dialysis in the country will not be more than the 1,200, which is the maximum, and will not be lower than the 400, as we have indicated. What this means is that the NHIA is able to take on the cost. Now, where do we get the money to pay for these dialysis sessions? First, I've already told you that we do have about 2.2 million left over from our pilots. Our budget for 2025, as projected, is supposed to be about 8.1 billion. Normally, half of that budget goes into claims. So we will do some internal rearrangements. We will look within to see whether to reduce our administrative costs to fund it. It wouldn't be any problem because at the end of the day, our current budget is about 6.8 billion. So to take 56 out and pay for it is something that we can do. So we also looked at the fact that the manifestos of both parties are uncapping the NHI. At the moment, we are capped at about 20%. So again, it's simple mathematics. 20 over 100 times our current budget, which is 6.8 billion. That gives you about 1.3 billion extra funds coming in. And I'm stressing that 1.3 billion extra funds coming in. And if you look at the maximum, which is 57 out of the 1.3 billion, it's actually insignificant. Now, our current budget, even if we are not uncapped, because taxes are overperforming, it's expected to be about 8 point something billion. And we will cover this under our benefit package. So there shouldn't be any problem. The next leg is what support can the NHI and the Ministry of Health give to these facilities in such a way that they are able to provide this service or these services. So in collaboration with World Bank, the ministry and the NHI are procuring some dialysis equipment. Currently, we ordered 30 of these equipments. 7 has been delivered, 23 of these equipment are to be cleared from the port. It's currently at the port. 15 additional ones have also been approved by the PPA just last Thursday. So we've set that into motion, we've put it into procurement. But the good news is each 15 of these machines comes with about 2,000 consumables. So it means that with the 45 machines, we have 6,000 set of consumables. 6,000 set of consumables. Now, with this, we have just had a meeting with the heads of facilities, and we are all in agreement that it is something that we can do, and we're going to implement it to the latter in such a way that our patients will benefit from this dialysis program that we are rolling out. With this, I can confidently say that the NHI will be able to fund dialysis in this country over many years. It is sustainable on the NHI, and we are committed to improving, obviously working with the facilities to also deliver the service. Now let me give you 2 additional things that we're going to do. So what is the root cause of all these kidney diseases? So the NHI this year added preventive and promotive services to the benefit package. So currently, Ghanaians on the amount of birth are being given the opportunity to visit any health facility of their choice to check their diabetes, hypertension, that's blood pressure, BMI, and other BMI and weights. What this means is that we will be able to reduce the incidence of kidney diseases. We will early detect it. We will also be able to detect hypertension and diabetes early for us to treat them. The next leg is the organ donation policy. The ministry, in consultation with stakeholders, have come up with this policy. It is at the consultation stage. So that will also add on to what we are doing. So with all these approaches, it means that we do have a comprehensive plan to dealing with this dialysis situation in the country. The government is also saying that the Agenda 111 hospitals will be having renal units where modern equipment of dialysis will be put in there to support Ghanaians in such a way that people will not have to travel to Kolebu, Komfanoche, or Kumasi and Accra before they are able to have access to these dialysis sessions. So it will be available in the districts. But as we are starting from the 1st of December, we now have listed some facilities across the country, and these facilities are represented here. That is why you see everyone, the heads of the renal units and the CEOs behind me, and some are also seated. So in unity, Ghana will be starting the dialysis program on 1st of December 2024 to bring comfort to our patients. Thank you. Taxes are overperforming, and let me at this point say that from 2016 till now, the scheme has actually grown by 6-fold. So we've expanded by 6-fold. So what this means is that we add 2 billion to our budget almost every year. And that is why I told you that our 2024 budget was 6.8 billion. It's moving to about 6.8 point something billion. Normally half of that is for claims. As we speak now, We are in November. Claims payments, the budget for the claims is still being underutilized because claims are, we've paid all claims. We've paid all claims, and it's amounting to about 2 point something billion. So we've not even reached 3 billion. So it means we even still have more funds from our claims budgets. So what this means is that we've done the modeling and we will be able to sustain it without any problem. The additional 1.3 billion that will be coming in, if you take out 57 million yearly, it's still sustainable over many years. So I think the question of sustainability should not be a problem at all. And that's why we have all these experts helping. We've done the modeling, and that is what I've actually presented to you. It is sustainable over many years. We know the prevalence as well, so there shouldn't be any problem. Yes, the promotive preventive. I think I agree with you. That is the best approach in actually reducing our cost burden. So that is why we have introduced the promotive preventive as part of our benefit package. Now, for our 20-year history, it has been curative, curative, curative. Curative means that you have to be sick before you go to the hospital. Now we are saying that we want to prevent the diseases. So we are introducing the annual health check, where Ghanaians are being given the opportunity to visit any health facility of their choice on their month of birth to do simple sugar, blood pressure, then body mass index. And again, we have just launched our e-health, our telehealth. So at the comfort of your home, you can now see a doctor. And education on all these are going to be intensified across the country in such a way that Ghanaians will know how to use our telehealth and to use the new innovations that we have introduced on board. So on this, we believe that on a long term, our cost burden will even come down. ECOWAS. Okay, so this scheme is for our members. It's for our members. So that is what I'll say. Thank you.